ADHD, or Attention Deficit Hyperactivity Disorder, is a type of mental illness that is one of the most common childhood conditions that gets diagnosed. Symptoms are usually apparent when a child reaches around 6 years of age. Once a child has ADHD, it is expected that they will continue to experience its symptoms well into adulthood. By that time, however, they are already well equipped to handle the mood swings, hallucinations, and anger associated with the disorder. What causes ADHD? The actual cause of ADHD is still largely unexplained. However, some researchers believe that it is due mainly to an imbalance in the chemicals present in the individual's brain. In some cases, researchers suspect that the condition can be influenced by genetics and the environment. As for how and why the disorder appears in specific individuals, however, there remains no apparent cause. Since the cause of the disorder remains unknown, doctors merely use medications and therapy to treat its symptoms. These are designed to allow the patient to regulate his temperament and live as everyday life as possible. Symptoms of ADHD. ADHD is characterized by the inability of an individual to remain focused on a single activity for a given period, something that people without this disorder don't require a lot of effort to do. It is also common for people living with ADHD to experience mood swings, ranging from complete delight, enthusiasm, and confidence one moment and shifting to depression, irritability, and aggression the next. In most cases, the particular reason for the specific behaviors is not easily identifiable. Another common emotion shown by people with ADHD is anger. They could, for example, become highly temperamental, which can result in outbursts and violent, aggressive behavior. This becomes problematic when the anger is directed towards another person or an animal. A person with ADHD may, at any one time, also exhibit specific symptoms, including restlessness, inability to get along with other people, disobedience, particularly to a person of authority, parents, teachers, or superiors, frustration, and impulsiveness. Dealing with mood swings, hallucinations, and anger. Once a person is diagnosed with ADHD, he is prescribed medications that help calm and keep him focused. These medications include antidepressants, anti-anxiety, and anticonvulsants, dosage and administration of which will depend on the individual's case. These drugs, along with behavioral therapy, are very effective in helping the ADHD patient manage his symptoms. There are a few drawbacks regarding these drugs, however. One common complaint is that some drugs could lead to hallucinations, especially medications used by children. The advisory committee of the FDA had made recommendations regarding the inclusion of warning labels on ADHD drugs to advise users and their parents of possible side effects. Other than medications, people with ADHD also do well in an environment where their disorder is well understood and accepted. Support from family and friends is also critical in helping the individual cope with his illness. Keeping safe with ADHD. As with every type of disorder, patients and their families must understand what exactly it is they can expect from a condition such as ADHD. It is also critical that they stay up to date with any news or information about treatments that may affect their health to prevent bouts of mood swings, anger, and hallucinations. ADHD is a treatable disorder, and there is no reason why anyone has to suffer unnecessarily from its symptoms.